Good afternoon. This is some talking points about the quality methods in healthcare for Chaparral Regional Hospital. My name is Nicholas Manco, and it is July 15th, 2020. Well, let's get started with the framework for quality improvement. First off, we want to bring clarity to quality and understand what it is. We need to measure and publish quality once we find out where we stand. We want to reward quality. We want to recognize that when we have good quality and the people involved with that, the leadership of quality, innovativeness for quality, and safeguarding quality. Bringing clarity to quality, what does quality look like? The analytics role in quality improvement. We have clinical effectiveness, but we only have clinical effectiveness if we have patient safety, and of course, patient experience is excellent. You want to measure and publish quality. You want to measure quality to discover where improvements are needed. There has to be transparency throughout the facility so we can understand what those discoveries are, and it's always a collaborative effort. Rewarding quality. There's a lot of incentives out there. Providers' incentives programs can be a powerful and rewarding tool. They can significantly improve physicians' responses to quality improvement efforts while supporting investments in the system needed to improve care at the practice level. Another key component is the leadership of quality. Leading by example, we hear that many times. So what does that mean? This assists other people see what is ahead when you lead by example, and how to act quickly to balance any challenges along the way. If people are led by poor leadership, they will experience more conflict. Innovate for quality. Utilization of up-to-date practices and technologies is essential. Taking a positive approach and utilizing up-to-date practices and technologies is one of the most effective things you can take in healthcare and use that will make a significant impact on quality of care, patient safety, length of stay, and mortality. It translates into substantial savings in quality of care for healthcare institutions. Safeguarding quality. Maintains safety and quality standards. Creating and maintaining a safe environment demonstrates compassion and diligence for the welfare of all patients. It is just as important as any other aspect of healthcare. Improving the work environment at times also improves the quality of safety for all patients. Speaking about clinical audits, defining quality standards and look at the shortfalls. For example, a 4-step audit process would have 4 stages. Stage 1 would be preparation and planning. Stage 2 would be measuring performance. 3 would be implementing change. And stage 4 would be substantiating improvement, including maybe a re-audit to see where you stand with your improvements. Performance benchmarking. Drive quality improvements by looking at the key performance indicators of other local and national facilities to better understand how to improve your own performance. What that is saying is you can look at other organizations to gain knowledge and ideas of how you can be better at what you do within your own organization. There's always, of course, root cause analysis. What causes the issue at hand or the opportunity? Is it patient factors, individual or staffing factors, tasking factors, communication factors? Is it team factors? Are people gelling for one cause? Is it education or training? Could it be equipment, resources, working conditions, organizational strategic factors? Finding that problem, that root cause analysis, always leads to solution. Quickly looking at pros and cons. Clinical audits. The pros of it is it identifies problem areas in the facility that needs a little extra attention. The con is it doesn't provide structure on how to improve quality when the problem has been identified. So an audit is an identification tool. The root cause analysis the pros is it identifies the problem areas. The cons is this doesn't lay out the groundwork for improvement. So you've dug down and you understand really why we're having this problem. And the performing benchmark, the pros is it improves quality with problems are due to human behavior, and cons is it does not identify problems if they are unknown. Once again, I'd like to thank you for joining us for this presentation of quality methods in healthcare for Chaparral Regional Hospital. Once again, Nicholas Manco, and you have a good day.